watching the brokers and the pharma people and the clinicians and the labor leaders and the legislators come together is really great. We're very proud within that context to introduce our next keynote speaker, Whalen, who is Chief Administrative Officer of King County, has been on the front lines mostly quietly for the last 5 years, though increasingly more prominently nationally, on the front lines of managing costs and improving quality from the view of an employer. That employer with 13,000 employees in King County has the added complexity of being deeply unionized, a mixed history of labor relations, generally positive, but mixed nevertheless, and so has the experience of working on, amidst, I think, among the most complex employer scenarios. And the result of that work and engagement over the last few years has been that they recently won among the most prestigious awards in all of government, the Harvard University Innovation in Government ASH Award. And so their story is now being told more prominently and nationwide. And so we're really honored that Carolyn is here with us today and is going to tell the story about King County and the employee engagement there. Carolyn, let's welcome her to the stage.
Well, it's great to be down south here in Portland. My name is Caroline Whalen, as in Caroline Kennedy, and I say that really proudly now that we have received the 2013 Kennedy Award. That probably was my proudest day in public service. I've been with King County for 20 years, and usually I'm the one who's staffing. I've written this speech, and I'm staffing a politician. So this isn't my normal gig, but thank you for having me. I'm really excited today to share with you King County's journey to sustainable healthcare costs and improved health in an aging workforce that earned us this Harvard Kennedy Award. And receiving that award really has encouraged me to get out more and tell our story. And Harvard generously gave us $100,000 as part of the prize, and so that helps us to fund additional education about our program. I hope that what I have to tell you today inspires you. Much of what I did with this program was breaking through barriers, and there are a lot of barriers to break through to make sustained change in health. And I hope that I'm really successful in entertaining you while you eat, and I think by the end of my session, my goal, the outcome that I expect, is that you'll be inspired and that you might actually want to sing and dance. So we'll see how successful I am. First, I want to give you an idea of who we are. DJ noted some of the statistics. King County is the 14th most populous county in the nation. We have over 2 million residents. We're the second largest service provider in Washington. We have about 12,500 employees, 30,000 covered lives. 85% of our workforce is represented. We have 108 bargaining units in King County. Think about that. We also have 95 elected officials, and for a while we had a 1-for-1 ratio. And I thought, great, I'll just assign an elected official to a bargaining unit, and that will be our negotiation. Our average age is 51. We just issued layoff notices last week. We have still a significant budget crisis in King County. We issued 217 layoff notices, and so our average age increases almost in dog years. Because of that labor environment, we do have a seniority-based system for the most part. So it's a very complex environment, pretty difficult to enact change, but we did a lot of change in King County. How did we do it? Number one, back in 2004, when we started the Healthy Incentive Program, we got the same wake-up call as the rest of the country. Our healthcare costs were rising at unsustainable rates. Our costs were rising at 13.5% annually. And so I remember the day that I had the white paper and I went down the hall and talked to then County Executive Ron Sims, and I said, you know, we have a huge problem. And he said, well, go off and do something about it. You know, so we did. We had really high rates of lifestyle-related chronic conditions in our workforce, and it was driving unsustainable healthcare costs. And people were sick. People were unhealthy. So now the picture is really different. And the data that I'm going to be sharing with you today is taken from the 5-year period that we really intensely studied from 2007 and through 2011. 2,000 people lost 24 tons of weight. Over 800 people quit smoking. More people are using quality health care. We saved $46 million. Our costs are now growing at about 4%. We still have significant budget issues, but we have saved a lot of public service as a result of these savings. So let's break down that $46 million. Of the $46 million, 14.6 is from improved health. We did the research and we were actually able to link lower utilization to reduced health risks. Those 800 people who quit smoking have fewer medical conditions for upper respiratory illnesses. Those 2,000 men and women who lost 5% of their body weight are much less likely to get type 2 diabetes. People are exercising more, and they find that they're able to stop taking medication for cholesterol and high blood pressure. $6.5 million we can associate with people choosing and shifting to higher value health care that's available in our market at Group Health. $24.7 million is from plan design changes. This includes employees taking advantage of incentive-based shifts to generic drugs, changes in our utilization pattern, and negotiated modifications to our employee health plan. We've lowered our cost in a sustainable way. We've not just shifted costs to employees, because we didn't first focus on just where to shift unsustainable costs. We looked together with our labor partners at how do we shrink the entire bill. So how did we do it? Our strategy from the beginning is really pretty simple. We focused on the demand and the supply side of the healthcare equation. This dual focus, I think, is really one of the things that Harvard pointed out as really distinguishing our program from others, is that we focused on measurement and transparency, and we really looked at the supply side of the equation. We also surround our employees in an environment where quality health is available and the healthy choice is the easy choice. Having created a culture that values health, we then influence the decisions our people make through the use of incentives. On the supply side, King County was the founding member of the then Puget Sound Health Alliance, now the Washington Health Alliance, and that was back in 2004. The alliance is comprised of employers, clinicians, hospitals, patients, and health plans all working together to measure and improve health care being provided. Currently, we have 3.3 million covered lives in our database, and our work, our sister organization is QCore. And so we, Mylea and I, have had the pleasure of getting to know each other at national conferences. The Alliance has a bold vision that by 2017, physicians and other providers and hospitals in our region will achieve the top 10% in performance nationally in delivering the, quality evidence-based care and in the reduction of unwarranted variation. To reach that goal, the Alliance has a number of tools: Evaluate, is a health care provider evaluation tool that was developed by businesses. We have the community checkup report, which evaluates and compares the validated measures and quality and appropriateness of care. And that data was so critical to us when we were making this change. We had the community checkup report, and when we went to the table with our unions, we said, it isn't King County saying this is where to get good quality care. This is a trusted, neutral third party, and it has the stamp of approval by physicians. That is the number one thing that our employees care about. It isn't what we say, it isn't what the health plan says, it's what does their doctor say. And the fact that we had done the work to really go out and validate the results with physicians made all the difference in the world when we were at the bargaining table. I can actually identify of that $46 million, 8.8 million was made possible because I had that data. And I'd be happy to unpack that for you if you're interested. We also use Choose Wisely. That is in partnership with Consumer Reports, and it helps us to educate our employees about how to make smart choices with their physician. And we're also now tackling cost transparency. I'm really excited and looking forward to a time where we have an all-payer claims database in Washington State. I really acknowledge the good work that QCOR has done, and I look forward to having the ability to marry the good quality and patient experience information that I have from the Alliance with cost data. This is a picture, and I know it's hard for you to glean, but it shows you what we get from the Alliance. This slide shows you the variation of quality of care that we get from the community checkup report. The green is measures above the regional average, gray is at regional, and red indicates below a regional average. And this is combining 22 measures along with patient experience results. So this is really confusing, even to you all who are experienced in this field, but you can't give that information to employees and really expect them to digest it. So what we do as the employer is we do the heavy lift. We do the benefit design work, and then we look for our employees to use cost calculator tools provided by health plans to make the more granular decision. So when we looked at this, when we were at the bargaining table back in the 2005, 6, 7 timeframe, one of the things that we heard from our labor partners is don't take away choice. We had looked at the data and we knew that we were getting good value from the HMO, group health, but some of our labor partners at the table referred to group health as group death. And, it was hearkening back to Harry and Louise, who some of you may remember in the back seat, managed costs, not managed care. It took us several cycles of the community checkup report to be able to show to our labor partners and to our employees that that wasn't the case, that we were actually, group health was actually doing an outstanding job. Then we looked at the data on cost, and wow, we save over $4,000 a year when our employees use group health. And we looked at the data. Can you explain that away? Was there really a demographic difference in the population? The answer was no. It was basically no difference in race, gender, age. So we said, well, we're going to build in incentives for people to choose group health because we save money when they do that. Also, not only do we save $4,000, but employees save over $1,300 per year for a family of 4, and that's a significant savings. So how did we incent people to choose group health and to make healthy choices? We reward them for participation. So bronze is the level that you choose not to do anything. Silver, you take we call it a wellness assessment instead of a health risk assessment. You know, a health risk assessment sounds really negative. Wellness assessment sounds really positive. So it's a wellness assessment. If you take the wellness assessment and then you do a follow-up action, you earn gold. And so let's talk a little bit about what kind of follow-up actions people can choose from. We started with 2, and now we have 10. So we have a really diverse population in King County, and people all across the spectrum of wellness and chronic disease. Some people are marathon runners, and they just need to quickly report what they are already doing. Other people have chronic diseases, and they need really much more assistance to improve. And so we offer people lots of choices. And the financial incentives are very, very healthy too. Take a look at this. So in order for me to earn gold, the lowest out-of-pocket expenses, not only do I need to take the wellness assessment and do a follow-up action, I have to get my husband Jerry to do it. Now, my husband Jerry, my friend Don Carlson's here, he knows my husband Jerry. Jerry wasn't real excited about this program. So here I am, the big cheerleader booster in King County. Wow, we're gonna save money, we're gonna get healthier. And I would come home and say, Jerry, you need to take this wellness assessment by January 31st. And well, you guys are a bunch of health Nazis, and when's Big Brother moving in? And I said, January 1st, 2006, do you want to help me make the bed? When I showed him the financial impact it would have on us if he didn't participate, he decided to participate. And so did 90% of our workforce. So folks, again, we're bringing it home. The spouse had to do it too. I had estimated that about 60% of our workforce would do it, 90% from the very beginning. And, that had a lot to do with the fact that we developed the program with our labor partners. So our labor partners were out telling their members, this is a good thing, you should do it. And what they got out of the negotiation was, we still do not charge premium. So the cost shift occurs at deductibles and coinsurance. This year we have just completed, we are at 83.5% of our employees are earning gold. And our goal is for 100% of our folks to be gold, because we want them to earn that lower out-of-pocket expense and become healthy. Let's look at some of the health results that we've achieved. The healthy incentives has really been a catalyst for health improvement. During the 5-year study period, our smoking rate dropped from 12% to 7%. 800 people quit smoking, as I mentioned, and our current rate for smoking, and by that I mean tobacco, is at 5%. We offer free tobacco cessation programs for smokers who want to quit, 100%. I think Jerry, my husband, has quit 7 times, and he still smokes a few cigars with Mr. Carlson here in the audience. So he's continuing to work on that. We also have had significant success in weight loss. This chart represents 10,432 members who participated in healthy incentives for 5 years for that cohort. They lost 4.5 tons. When you compare that to the national control group that was gaining weight for the entire period, our members lost 24 tons. Interestingly, the population that experienced the biggest weight loss in this group were African American women over 50. I personally lost nearly 40 pounds. And I have kept off about 35 of those. What our employees told us from the very beginning, if you want us to change, you're going to have to help us. We can't do this by ourselves. You know, we spend more waking hours in the workplace than we do at home. So what are you going to do to support us? So we have done so much to help people make the healthy choice, the right choice. And here are a couple of examples for you. Eat Smart. Really, the first thing our employees said is, please bring a weight management program to us. Because we're government, we had to go through an RFP process, and we ended up contracting with Weight Watchers at Work, and we now offer Weight Watchers online community meetings and at work. And one of the side benefits of the worksite program is that people get to know each other who didn't really know each other before, and they have a common problem that they're solving. I got to know so many people that ordinarily I wouldn't get to know. I think that starts to influence a healthy workplace too, because I walked with people. One week I knew I was going to be over, and I actually gave blood before the weigh-in, and I did really well. But people didn't really know me in that way, and I became more accessible to them. Another really creative thing that we did that really drove our risk management people crazy is we built this garden, and you can see what we started with and what we ended up with. We donate hundreds of pounds of food to the senior center, and we teach people how to garden and how to raise their own food, and so it's pretty cool. Move More, the folks doing yoga there, that is an employee-led program. We also have Zumba, kickboxing. We turned a space that was programmed to be storage space, and I said, hey, can't we turn that into a modest activity center, because we're government, right? It can't be a gym. And for $350,000, we outfitted that space and put circuit training in for designed for kind of the older set, and we got risk management on board and a room full of attorneys, and now we have great programs right in the workplace for our folks. And for those who don't have access, we have gym discount programs. A lot of docs in the audience. You guys know getting a flu shot really helps. So we vaccinate more than 3,000 people at 27 work sites throughout the county. And in focus groups, we learned that people will get a flu shot not for themselves, but to protect people they love. And so we've done a lot of work around branding. I mentioned the health risk assessment versus the wellness assessment. That's really a result of talking to our employees about what resonates. So branding is really important. Our workforce, because they're older, they want to be healthy into their retirement. So we build that into our outreach to our folks. We also use consumer education, Own Your Health. We get that through the Washington Health Alliance. And we give people incentives. They can earn that gold level by going online and using tools. And so we drive a lot of folks to this website. First things first, we want folks to have a primary care provider. We want them to seek quality health care. We want them to tell their doctor what's going on, and we want them to follow through. And we roll this out through websites, emails, newsletters, and posters. Data's great, but the stories is what really resonates with people. Daisy, pictured here, lost 100 pounds. She's now really active with her children, much more productive employee. People quit smoking. I love this one, the judge who lets her staff come into the court with wet hair after lunch. You know, it's the little things, right? We try not to have lunch meetings. We try to let people have a break during the day and really encourage health. We even have fewer donuts in the sheriff's department. I don't know if that would work in Portland because you have the maple bars with bacon, but it's working up in Seattle. So lessons learned, it has been a long journey. It's really been a 10-year journey. And we continue to plan, do, check, act. We continue to evolve and improve the program. When we transitioned elected leadership in King County from Ron Sims, who really launched this program, big advocate for the program, Susan Johnson, you remember those days, moved into Dow Constantine, very smart guy, very different guy, and he just said, Caroline, I want to be able to do stuff on this. And so we really moved the program, into the mobile environment. We now have Text for Wellbeing. We work with Rip Road, who did texting for American Idol. They built a program for us. And so we continue to change the program up. And that really resonates with our employees. They ask for something and we try to make it happen. That labor partnership has been key, as I've mentioned. Incorporating measurement and reporting results, that's really resonated with our elected officials. Our King County Council counts on us to bring forward meaningful results in the form of data, and I think that was a key attribute of our winning the Harvard Prize. I think getting over the privacy issues was an initial obstacle, but we have been able to prove to employees that we really do respect their privacy, and we'll do everything we can to make sure that it's handled in a secure and confidential manner. And that third-party source of data from the Puget Sound Health Alliance has been really important. And now I want to give you some really true inspiration before I take questions. And this film features our own employees, and this is going to make you want to sing and dance.
So let's dance, it's your last chance. Let's dance, the last chance. Let's dance, the last chance. Oh, oh. Last chance, oh, oh. Yes, it's your last chance. Oh, oh.
was a lot of fun. That really was geared to our transit workers. That is almost 4,000 of our 13,000 employees are transit drivers. They work in isolation. They have tough schedules, and they were telling us it's really hard for us to earn gold. And so we had a program really designed that the Road to Gold was designed for our amalgamated transit brethren and sisters. And it increased. I mean, we broke through the bronze barrier with our transit workers, and we're still working on it. So I would love to take questions if there's time and technical availability to do that.
Caroline, I first just want to say, awesome, great presentation, home run. I told you, we were talking before, and being an anxious worrywart, so let's just give her another round of applause. Over here with you, Dana.
Hey, Carolyn. Tanya Barham with Multnomah County. Hey. So we know your program pretty well, and one thing that I think it can be tempting to assume when hearing the presentation, if people aren't familiar with it, is that just putting in place the health engagement model with the incentives is all you need to do. But I happen to know that you guys did a huge amount of pre-work and had a whole marketing and communication strategy that involved a lot of hours and continues to, behind the scenes, to continue to keep engagement high. The incentives are important, but it's not the only piece, as well as the purchasing coalition and the benefit plan design. Can you talk a little bit about how that started with Ron Sims,
Sure.
how that continued before the rollout of the health engagement model, and then what you do now?
Sure. Great question. Thank you. So we really started back in, started with a white paper in 2003. We formed the Health Advisory Task Force, group of 20 people, economists, labor leaders, physicians, and we asked them, you know, what can we do? And they said, you got to get your employees healthier, and you've got to control what's going on in the healthcare market. And so they issued a report in 6 months, and we actually did something with it. So a white paper to a task force, you know, it's kind of government, right? But then we took action. And that started with conversations with our labor leaders. We started reading the same books, Epidemic of Care, Overtreated, and started looking at solutions together. We created the Healthy Incentive Program with our labor leaders. We came up with it together. And then we spent 2005 going out and talking all across our workforce, all shifts, about what the problem was and what some of the solutions might be. And then in 2006, we asked people to participate, and then that contributed to their gold, silver, bronze level in 2007. But we did spend a lot of time talking to people first, getting them on board, and then really getting our labor leaders to communicate with us, and that, I think, is what contributed to the high rate of participation. We invested a lot of money initially, and it was with the understanding that it was going to be a 3 to 5 year investment before we started getting the payoff. We do have a return on investment of 3 to 1, but it was a really scary beginning, especially for our elected leaders, to approve funding for this. And Ron Sims was just an amazing leader that launched this. And with the foundation of the Puget Sound Health Alliance, the King County actually funded the database. I was the, fund manager for the benefit fund at that time. And I said, you want me to pay for what? But what a great decision that he made. I don't know that we would have that database without him. We would not have been able to save that 8.8 million without access to that data. So we now spend about $9 per employee per month to keep our program going in the workplace, for that support in the workplace, and also our continual look at the redesign of our benefit plan. And I think that $9 is $9 very well spent. Did that answer your question?
Yes,
There was recently an article, I think it was in Forbes, regarding the performance of firms whose CEOs were marathon runners, and they found that those firms outperformed those who weren't. In thinking about that, and I'm thinking about the productivity of your employees as they improve, do you have any information, have you tracked any data regarding productivity when people lose 40 pounds?
You know, I wish the answer to that was a resounding yes. We are working on getting that data. We have done, through our wellness assessment, we have some questions about, you know, whether you're present or not. We haven't seen a marked difference thus far, but I can tell you that, you know, we will get that data. At the same time we were doing this in 2012, another little project I was working on was we moved off some legacy mainframe environments. We did an enterprise resource plan, and we now are all on one payroll, and I think we now have an ability to capture that data and track it with the health risk assessment. And so I look forward to coming back maybe a year from now and reporting that I have that data.
Other questions? Caroline, what are the lessons from what you have learned that can be applied either to smaller firms, 200 employees maybe, or you know, and then what are the lessons that you've learned that can be applied to a health plan with a heterogeneous mix that doesn't come to the same four walls? Any suggestions or thoughts on applying your lessons to those two?
You know, I think with a small firm, I think our toolkit can apply. We do have a lot of information on our toolkit. I think talking to employees is a great place to start. You know, one of the things we're doing with tracking, you know, to your point about sick leave is we now, in my department, go and talk to people who have less than a week of sick leave in their bank and ask them what's going on. And not from a punitive standpoint, but from, I care about you. Tell me what's going on. How can I help you have a healthier bank to rely on if you get sick? You know, I think any size employer can do that. And by talking to people, we found out, what do you need to do? What kind of support do you need in the workplace to eat smart, move more, quit tobacco, get a flu shot? You know, let's do that. And breaking down barriers. So I think, you know, it doesn't have to be a big, expensive program. It can be as simple as talking to people and asking them what they need. And in terms of your second question,
How health plans who have a diverse member population rather than a firm that has everybody show up to the same locations, what can they learn from your lessons?
okay, well, my firm has people all over the place. So I think our demographics are pretty representative of a general population. So we have bus drivers, wastewater treatment, carpenters, analysts, and we've figured out a way to communicate with just about everybody in our workplace. So I think you can apply that to the general population. I mean, I think one of the differences is, but with the Affordable Care Act, it's less of a problem, is all of our employees are very well insured. So
Good.
we have that distinction.
Yeah.
I'm just curious, what are some of the barriers for people going for the gold? And a follow-on is, I'm assuming that the kids of these gold members are healthier too.
We absolutely have seen evidence of that. You know, in our Health Heroes, people talk about, sometimes it's the child that motivates them. Daisy, the woman up here who had lost 100 pounds, her motivation was that she wanted to be able to do things with her kids. She found that she was just sitting on the couch and watching TV on the weekends. And the Healthy Incentive Program, she decided to use the action plan of Move More, and she actually started getting off the couch and doing things with her kids. And that helped her lose the weight. I think barriers to goal that we've tackled, people don't have access to computers, and we had a lot of online programs, so we have to provide paper. And a lot of vendors don't want to do that anymore, so we actually had to bring our paper option in-house to do it. And a lot of our bus drivers, want to do the paper option. People, finding the time to do things. Before we moved to mobile applications, people felt like, they wanted to be out running. They didn't want to be sitting at a computer documenting that they ran. So we just really had to make it easy for people to tell us what they were doing. And what we found is that, people want to be healthy. And so if you give them tools and that just constant communication in the workplace, it really helps. It's harder for people who are working in isolation. We found that we had higher bronze levels with the bus drivers, with our custodial staff. We do have some English language. English is a second language barriers, and we just try to do everything we can to talk to people, find out why they aren't participating. There's a segment of our population that will never participate. They don't trust that we're going to hold their data confidentially. And so, unfortunately, they suffer as a result of that.
Again, let's give her a round of applause.